In this video, we are going to demonstrate the surgical removal of horizontally impacted tooth, commonly known as a third molar or wisdom tooth. After administering a local anesthesia, we start by making an incision in the gum tissue to expose the impacted area. A surgical flap is created to gain clear access to the bone and the tooth. We are using specialized instrument, nothing but a periosteal elevator to elevate gum tissue. Next, a surgical handpiece is used to remove overlaying the bone, revealing the horizontally positioning tooth. Then, because of the angle, the tooth is sectioned to smaller pieces to allow for controlled removal with minimal trauma to surrounding tissues. Once all fragments are removed, the site is thoroughly irrigated with saline and betadine to clear debris. Then we suture the gum area to promote healing and minimize the discomfort. The patient will be given after-care instructions and medication to support recovery. Healing typically occurs over the following weeks with regular follow-up. Thank you.